We may experience generalized or high anxiety because the constant stressors artificially raise our adrenaline levels. This indicates that the body is operating at a significantly higher level of anxiety, which results in a wide range of anxious feelings, emotions, and sensations. Although distressing, the symptoms of generalized anxiety are typically different from those of a panic attack. They can still be very uncomfortable. You might experience chest pain, palpitations, racing, or slower heartbeat, sweating or coldness, vertigo, or trembling. You might experience clamminess, weak or trembling legs, and flu-like symptoms. Generalized anxiety disorder, GAD, is a health condition characterized by excessive and persistent worry or anxiety about various aspects of life, such as work, relationships, health, or daily activities. People with GAD often experience heightened anxiety and tension, even when there is no apparent reason for concern. These worries are often difficult to control and can interfere with daily functioning and overall quality of life. Generalized anxiety disorder, GAD, is characterized by excessive and persistent worry and anxiety that goes beyond what would be considered normal in everyday life situations. Individuals with GAD may constantly anticipate disaster or have a pervasive sense of impending doom. The anxiety experienced by someone with GAD is often disproportionate to the actual circumstances and can be difficult to manage. The worries associated with GAD can vary from person to person but typically revolve around common concerns such as health, finances, work, family, relationships, and general life situations. These worries are often persistent and intrusive, occupying a significant amount of the person's time and attention. Individuals with GAD may find it challenging to control their worrying, which can lead to further distress and anxiety. The symptoms of GAD can extend beyond psychological distress and may manifest physically as well. Some common physical symptoms include muscle tension, restlessness, fatigue, irritability, sleep disturbances, difficulty concentrating, and gastrointestinal issues like stomachaches or nausea. It's important to note that GAD is a distinct diagnosis separate from other anxiety disorders, such as social anxiety disorder or panic disorder. Although individuals may experience symptoms of multiple anxiety disorders simultaneously. Here are some key features and symptoms commonly associated with generalized anxiety disorder. Excessive worry. Individuals with GAD tend to have an ongoing pattern of excessive and uncontrollable worry about various issues, such as personal health, work, family, finances, or global events. The worries are often unrealistic or disproportionate to the actual situation. Difficulty controlling worry. People with GAD often struggle to manage or suppress their worrying thoughts. They may feel like their worrying is uncontrollable, leading to a sense of helplessness and increased anxiety. Physical symptoms. GAD can manifest physically, leading to symptoms such as restlessness, muscle tension, fatigue, headaches, irritability, difficulty concentrating, sleep disturbances, and gastrointestinal problems like stomachaches or nausea. Chronic anxiety. GAD involves persistent anxiety that is present most days for at least 6 months. The anxiety may fluctuate in intensity but tends to be present in the background even during relatively calm periods. Avoidance behavior. Individuals with GAD may engage in avoidance behaviors to reduce their anxiety. This can include avoiding situations or activities that they perceive as potentially stressful or anxiety-provoking. Impact on daily life. The excessive worry and anxiety associated with GAD can significantly interfere with various aspects of life, including work or school performance, relationships, and social activities. You might get disturbing thoughts or feel depressed. This is perfectly normal and will pass. Normal and will pass. It is a purely chemical response to anxiety and must not be mistaken for depression. Remember, these thoughts and feelings are harmless, they are just unpleasant. A good way of gauging whether you have anxiety disorder or depression is this. Ask yourself what came first, the anxiety or the depressive symptoms. If you say the anxiety, then you are probably suffering from the fed up thoughts associated with your anxiety and its symptoms. If, however, you experience the depressive thoughts as a forerunner to your anxiety, could be suffering from a depressive illness with anxiety as a feature of that. Sensations have never harmed anyone and will not. Please watch next video on panic attack and panic disorder. If you like this video, please subscribe and hit the like button.